Name is Dr. Sanjeev Bagga, and I will be talking today about sexual problems in older men or mature men. Um, Let me start by acknowledging my resources. I have picked up some of this information from UpToDate, the Mayo Clinic website, and Cleveland Clinic website. This is only for patient education and is not meant to replace good medical advice from a well qualified medical practitioner. If you have a heart problem, please consult your doctor before using or self medicating yourself for sexual problems. I would like to explain to you how normal erections happen and what happens as we are growing up. The nocturnal or nightly erection starts spontaneously 3 to 4 times at night, starting in early adolescence. For the penis to get erect and maintain that erection, it is important that blood flow from the arteries into the spongy tissue, which is called corpora cavernosa. These paired corpora cavernosa flank the penile urethra. Now, urethra is the pipe, in a layman's language, that enables us to urinate, and the end of that pipe is the opening of the urethra at the tip of the penis. The other important tissue is corpus spongiosum, which is seen at the tip of the penis, which is called the glans penis. Now, for erection to happen, not only does it require more blood flow or arterial flow to come into the penis, but it is also important that the venous flow, which normally would empty out, is retained to maintain a firm erection. Now, there is a chemical called nitric oxide which maximizes the blood flow and causes penile engorgement. And it is important for normal erection to have good and adequate arterial inflow, which is a source of oxygen and nitric oxide. And nitric oxide, the chemical, acts by generating a chemical called cyclic guanosine monophosphate, or cyclic GMP or CGMP, which is helpful in maintenance of erection by dilating or expanding the arteries of the penis and thereby widening them, enabling more blood or arterial flow into the penis. And loss of erection happens because there is a breakdown of cyclic GMP and less engorgement of the penis, which results from it. Low nitric oxide is found in people who are smokers, people who have diabetes, people who have testosterone deficiency, and these conditions are associated with a high incidence of erectile dysfunction. Now, there are four medications that are available today, namely sildenafil, vardenafil, tadalafil, and avanafil. These are called phosphodiesterase inhibitors, and they increase the blood flow in the uh, corpora cavernosa by increasing the cyclic GMP, and thus help in erection and also in the treatment of erectile dysfunction. Now, as we age, we all know about the heart disease, and similarly in the rest of the body, there is deposition of fat and calcium in the arteries, which you can describe as atherosclerosis. When that also affects the artery called hypogastric artery and the feeder arteries to the penis, there is reduction in the blood flow to the penis and reduction in the oxygen levels in the cavernosa with reduced nitric oxide activity. Now, if a person has testosterone deficiency, it leads to impotence, whereas restoring the testosterone levels by injections restores the person's potency. Sexual activity is affected by three major factors: the age of the person, the health status of the person, and the gender of the person. As we grow older, both men and women have issues related to sexual activity, and people who are in poor health with multiple medical problems also suffer from erectile dysfunction and other sexual problems. And it has been found out that men are sexually more active compared to women as they age. Um, Now, men suffer from sexual dysfunction in three basic problems. One is that they have problems with their erection, their desire for sex goes down, and they have premature ejaculation. This problem starts in early 40s, and as men age, it becomes worse. About 40% of men at the age of 40 and above have some problems in their sexual function, and as every 10 years or every decade, more than 10% start reporting decreased sexual activity and capacity and performance. And people report age related decline in sexual intercourse, erection frequency, and sexual desire, and also poor satisfaction with sexual orgasms. The frequency of sexual activity decreases with age in both men and women, and it is a common problem with aging. Some of the causes of low libido or low sexual desire are people who are on medications, whether for depression or high blood pressure or heart related issues, people who are alcoholics, people who suffer from depression, suffer from fatigue, have multiple medical problems, testosterone deficiency, people who abuse drugs are the ones who suffer from low libido. Now, erectile dysfunction may be defined as inability to have or maintain an erection which is of sufficient uh, rigidity and time for a satisfactory sexual intercourse. Now, in men, this is the most common sexual problem. And with exercise, there is a lower risk of erectile dysfunction. So, I cannot overemphasize the value of exercise in one's life. Obesity, smoking, being very inactive and sedentary, and the presence of multiple medical problems also increase the risk of erectile dysfunction, or ED as we call it. Now, when obese men start exercising and lose weight, there is improvement in their erectile dysfunction. Um, Also, men who are less sexually active to start with have more erectile dysfunction than men who are sexually active, or more sexually active, to put it this way. Men who have more than one intercourse per week generally suffer less problem with erectile dysfunction compared to men who have less than one once per week sexual intercourse. People who have risk factors for heart disease like smoking, obesity, high cholesterol, and they also suffer from higher incidence of erectile dysfunction. The best predictors of erectile dysfunction are if you're older, if you are diabetic, you have high blood pressure, if you're heavy and obese, you have cholesterol and lipid problems, heart disease, smoking, and some of the medicines cause this. People who suffer from obstructive sleep apnea and restless leg syndrome, people who have scleroderma, Peyronie's disease, and after treatment for prostate cancer suffer from erectile dysfunction. Now, amongst the diabetics, there is an increased incidence of erectile dysfunction, and part of the reason is that there are some factors associated with diabetes that also contribute, such as peripheral or autonomic neuropathy, which means the arterial supply to the nerves is affected. The arterial supply to the retina or the eye is affected, and the longer the duration of diabetes and the poorer the control of diabetes leads to higher incidence of erectile dysfunction. So, it is important to emphasize good diabetes control is very important. Um, Now, obviously, if a person has diabetes and experiences erectile dysfunction, it leads to depressive symptoms, and on the other hand, depression also leads to erectile dysfunction. Some of the antidepressants are a cause for erectile dysfunction. There are some other medications, as you can see in this list. One of the common medications, cimetidine, is used for reflux and is a common cause of erectile dysfunction. Now, premature ejaculation can be defined as ejaculation that happens within seconds or less than a minute of penetration into the vagina, and this leads to this. This is a very common problem. that some of the men experience. 4% of male population suffers from this, and up to 30% of men complain of ejaculating too fast. Now, 30% of men who have premature ejaculation also have erectile dysfunction. Um, Now, how do we treat erectile dysfunction and some of the sexual problems? Uh, well, of course, we have medication, and I started with the introduction about phosphodiesterase medication. Then, of course, psychotherapy and sex therapy. There are injections that can be injected into the penis. There are vacuum devices. There is a possibility of surgery with penile implants, and there is possibility of introducing medication through the urethra, or the opening of the penis. These are the ways to treat erectile dysfunction. The first line and the easiest way is to take medication. Medicines, this group of medication is called phosphodiesterase inhibitors. They are very useful because they are very efficient, they are easy to use, and they have not many side effects. Um, and as I mentioned, that these medications work by increasing the cyclic GMP and thus improving the ability to maintain an erection. Now, the commonest medicine that you may have heard goes by the name Viagra or sildenafil, which typical dose is 50 milligrams, can increase up to 100 milligrams. Remember, sometimes increasing the dose helps, and sometimes decreasing the dose helps, especially if one is facing side effects. There are four medications, as I mentioned. Vardenafil, typical dose is 5 to 20 milligrams. Tadalafil, the dose is 10 to 20 milligram if you use it on an irregular basis. But once you start using it on a daily basis, 2.5 milligram is good. Um, I will be giving you more details. Now, Avanafil, the typical dose is 50 to 200 milligram. All of them are equally effective. It is believed because tadalafil has a longer duration of action. It is more helpful in some cases, and Avanafil and orodispersible vardenafil have a more rapid onset of action. So, orodispersible means that when you put it in the mouth, it gets dissolved in the mouth, and so it leads to a quicker action. I mentioned about the choice of drugs. That's entirely a matter of choice based on the cost and other side effects, but the side effects are also very similar. Sildenafil is the most commonly used medication. It has been used for a longest duration of time, so we have the best data on it. It should be taken by mouth on an empty stomach 1 hour before the planned sexual activity. Start with 50 milligram. You can reduce it to 25 milligram if there are side effects, or you can increase it up to 100 milligram if you need a better response. The duration of action is about 4 hours. Now, um, when one says the effect lasts for 4 hours, it just means that the time frame that erection is possible. It does not mean that the erection will last for 4 hours. And very important to remember, you only take one dose per 24 hours. Now, Levitra is the name for vardenafil. Cialis is the name for tadalafil, and Stendra is the name for avanafil. Um, for vardenafil, the erection can be achieved as soon as 30 minutes and up to 4 hours after taking the tablet. And again, not more than one dose be taken in 24 hours. Now, tadalafil, the erection is possible within 1 hour up to 36 hours after each dose. Again, not more than one dose should be taken. And once a certain blood level is achieved, tadalafil can be taken as a low dose pill every day, and then one doesn't have to wait for its effect to kick in, like we said about the Viagra, where the effect starts after an hour and lasts up to 4 hours. So daily tadalafil can be helpful for men who respond poorly to on-demand phosphodiesterase inhibitors. And again, I want to emphasize this. So let's say that you were taking a Viagra tablet, but the instruction was, expect a good effect after 1 hour. and the effect can be good up to 4 hours. But with tadalafil, the good thing is that with low dose, you don't have to wait for its effect to kick in. You can achieve an erection with a low dose pill on a daily basis, and it doesn't have to then correspond to a certain time period in which you have to have sexual activity. Now, the Avanafil, the onset of action is 15 to 20 minutes, which is somewhat faster than the other three medications. Side effects of all these are common, except for one or two side effects. People suffer from headache. There is flushing or redness of skin. Indigestion can happen. Dizziness can happen. With Viagra or sildenafil, you can have blue tinged vision, but these are short lasting side effects and resolve spontaneously. Very important to remember that if you're a heart patient who's on nitrates or nitroglycerin, please do not take this medicine because it can cause a dangerous fall in blood pressure and predispose a person to a heart attack in that situation. Although taking the medicine per se does not cause any heart attacks. So it should not be, these medicines should not be taken if a person has a history of heart attack, stroke, or life-threatening irregular heartbeats within the last 6 months, or the person is having an untreated low or high blood pressure. And it should not be taken with an eye condition called retinitis pigmentosa. Now, if you are planning to take this medicine, then it is expected that you are physically fit enough to walk 4 to 8 kilometers per hour on a flat surface. If you are not capable of this, then perhaps you may not be a good candidate for this medication. The next way to treat erectile dysfunction is to inject in the penis. There is a learning curve to this. The patient is taught how to inject into the corpora cavernosa. Obviously, it is important that the skin of the penis be cleaned well, and sterile technique be used. Um, and once the injection takes place into the corpora cavernosa, the medicine acts by allowing more blood flow into the arteries. And the important thing to understand about this particular medication is that sexual stimulation is not required. The erection will happen irrespective of sexual stimulation, unlike the medicines that I described before, the four medicines. Those require sexual stimulation. For penile self injection, no sexual stimulation is required. And it takes some time for men to understand how to inject and feel comfortable. Some men suffer and don't want that anymore because of the pain. So, pain is a side effect. Again, it depends on your tolerance of pain. And some men discontinue because of the pain. There is a small risk that you may suffer from a condition called priapism, which means that the penis is erect for a longer period of time of more than 4 to 6 hours. If that happens, it is a medical emergency and needs urgent medical attention. And if an erection is maintained for more than 48 hours in this type of a situation, it can lead to permanent damage to the penis and scarring. Now, there is another alternate way to treat this condition, namely, you put the medicine through the urethra or the opening of the penis, um, as we describe this as intraurethral installation of medicine. One of the common medicines is called alprostadil, and it has an advantage that it is absorbed into the erectile tissues or corpora cavernosa to create an erection. Pain is less of a side effect, and also scarring is less of a side effect. Also, the prolonged erection or priapism is a less of a side effect. The penile injection uses a tiny needle and syringe. The man injects a small amount of medicine into the side of his penis, and the medicine relaxes the blood vessels, thereby allowing more blood flow into the penis. The three most common medicines are what are called prostaglandin E1 or L-prostadil, papaverine or Papacon, and then phentolamine, which is also known as Regitine. This is an illustration that I took from Up to Date, where a person is injecting using a using an insulin syringe with a very thin needle into the penis, and the diagram below shows you the cross section of the penis with these two structures in red, uh, labeled as corpus cavernosum. So the person has to inject in the corpora cavernosa, and the and the syringe is held at 90 degrees. So once the medicine diffuses, then erection is achieved. Um, the next way to achieve an erection is by using what is called a vacuum assisted erection device. Basically, a person would place the penis into a plastic cylinder and create vacuum around it, which would increase the blood flow to the penis. And for the erection to be maintained, a rigid ring is then placed at the base or the very bottom of the penis, which allows the blood to stay there and let it persist, and thus allowing the penis to stay erect. Now, the person has to hold and pump the device. It takes about a week's learning, and once a person gets used to it, it leads to satisfactory sex. It has some downside or disadvantages. One of them is that the ring that holds the blood and allows the erection or maintains the erection also compresses the urethra, and this prevents the semen from being discharged, but the orgasm is not affected by the ring. So I'm going to show you an illustration. So the steps are: you place the pump over the penis, you pump air out of the cylinder to create a vacuum, and then the vacuum draws blood into the penis. Now, once the blood increases and comes into the penis, it becomes erect. But at the same time, we don't want this blood to leave the penis, to maintain the erection. So once the penis is erect, lubricant is used to slide the retaining band down onto the lower end of the penis, and then the pump is removed. Now this band can be left for 30 minutes to allow for successful sexual intercourse. Now this is an illustration that I took from the Cleveland Clinic website, and there is a device which you can call as a vacuum constriction device or vacuum assisted device. So this person is holding the penis in this vacuum constriction device, and once the vacuum is created, erection is achieved, and then this person would slide that ring which is seen at the very bottom, and once the ring is in place, the pump is removed or the device is removed, and erection is achieved, and the ring stays in place for 30 minutes, and after that the ring is taken off. Now, 50 to 80% of men are happy with it. Others obviously stop after a brief trial. It costs about $300 to $500, and it is useful in men who have medical causes for erectile dysfunction, people who have poor blood flow to the penis, and they have more um, or excess blood flow out of the penis during erection through the veins, and those who have suffered a nerve injury, uh, and also a good treatment for those who suffer from anxiety. Now, it is safe to use and has fewer long term side effects once a person becomes used to it. Now, remember that the erection that is achieved in this way is not a natural erection or erection achieved in the normal process. So the penis becomes purplish in color and it is cold. So a lot of people use warm compresses on it before having sex. The side effects include numbness, no ejaculation, and then bruising and swelling of the penis and difficulty achieving orgasm. I mentioned about the price. The last thing I want to talk about is the penile prosthesis. These are surgically implanted. These consist of semi-rigid rods or inflatable cylinders that are inserted into the corpora cavernosa. Then these are inflated with a pump to get an erection. They have become less popular because of the easy availability of the penile injection therapy as well as the phosphodiesterase inhibitor medication like Viagra, etc. Now, those who do not respond to medical treatment or find the vacuum erection therapy not to their liking can use this particular procedure. Now, this is a surgical procedure that needs to be done, and I will show you some illustrations. um, the side effects could be infection, erosion of the device, pain, and mechanical failure of the device. When that happens, it has to be physically removed by surgery and a new one put in there. Now, I mentioned how this works. Now, the important thing is that this becomes a part of the man's body, and he can go anywhere and have an erection whenever he wants it, and it preserves the sensation in the penis, normal orgasm and ejaculation, and essentially these are inflatable cylinders that are planted into the corpora cavernosa or erection chambers of the penis, and then through a reservoir of fluid, they are distended and or inflated, and once a person finishes the sexual intercourse, the cylinders are deflated and the person loses erection. uh, I mentioned that the complications are infection and failure, and a surgical procedure has to be performed to put them there. And the procedure requires only small incisions, and it is not. Nobody can look at a person and say, "Well, this person has these this prosthesis." Now, 95% of the people have successful surgeries and have 90% satisfaction rate. So this is one example of a type of implant which is called a three-piece penile implant. And as you can see, there are cylinders in the penis. And there is a reservoir in the lower abdomen, and then there is a pump and a release valve. So the person uses the pump, which is in the scrotum, to bring the fluid into the cylinders, which creates the erection. And once he's done with his sexual intercourse, the release valve is pressed that allows the fluid to be drained out of the cylinders into the reservoir. There are other designs. The next one is a two-piece penile implant, and the third one is a semi-rigid penile implant. I took these illustrations from Mayo Foundation for Medical Research and Education website. Now, I mentioned about the medication. I just want to go over these a little bit more. So, vardenafil shares a similar structure, onset, and duration of action and side effect profile with sildenafil. It has the duration of action of 4 hours. It is available in 10 and 20 milligram tablets. There is a new formulation which is orodispersible, that is, it disintegrates or breakdowns in the mouth. It has more rapid onset than the standard oral formulation. So some people prefer it, and then of course the it is effective when the person has eaten. It doesn't have to be taken by on an empty stomach. Now, the American College of Physicians recommends that any of these medicines can be used. Out of those four, sildenafil has the longest safety record, and it is important to remember that nitrates should not be taken with these medications. They can really lead to problems. And those who are on alpha adrenergic blockers because of the increased risk of low blood pressure. Those who are on sildenafil or Viagra suffer from blue vision, but this spontaneously disappears, and this is only there for 2 to 3 hours. With other medications, this has not been reported. Um, these medicines have been associated with rare reports of sudden hearing loss, but this happens only on one side, happens usually in the first 24 hours, and in one third of the cases, it is temporary. A risk of malignant melanoma or skin cancer has been reported in some studies, but other studies have not confirmed this. Um, sildenafil, vardenafil, and tadalafil should be taken 60 minutes before sexual activity. Now, remember when I said about tadalafil, um, once you start taking it on a long-term basis and a certain blood level builds up, you can have a low dose and you don't have to wait 60 minutes. Um, and again, important to emphasize that the onset of action may sometimes be more rapid than 60 minutes. Um, Now, tadalafil, I mentioned again, is effective for up to 36 hours after dosing. So one can use a daily low dose tadalafil administration, which eliminates the concern about onset and duration. One doesn't have to wait for its effect to kick in. Um, Now, sildenafil and vardenafil usually are taken on the empty stomach, and I mentioned that there is a formulation for vardenafil which is different. Um, for tadalafil, the food does not interfere. Now, avanadafil or ODT, vardenafil also, food doesn't matter. The side effects I have mentioned already. So people who suffer from heart disease and low blood pressure, you know, and people who are on nitrates have to be very careful and shouldn't be taking this medication without medical supervision. So these medications, if they are ineffective, then the person can use vacuum devices, injection into the penis by himself, and then of course putting a medicine into the urethra or the opening of the penis. The American Urological Association guidelines emphasize a flexible approach and giving the patient a choice. And the choices I've already mentioned. It can be medication, it can be self injection, it can be putting the medicine into the urethra, a vacuum device, and surgery. The last point, and I think that's the most important take home point, is to remember that if you lose weight, if you become physically active, and if you minimize your cardiovascular or heart related risks, you would have a much happier and good sexual life. With this, I finish, and good luck to all of you.